Start by gathering your supplies. You'll need a mask for your patient, sterile gloves, a Tegaderm with CHG, a power lock needle if you're accessing a power port, and a regular needle if it's a non-power port. CHG swabs to cleanse the site, a flush, a Luer lock cap, and 4x4 gauze sponges. First, you'll want to verify whether the patient's port is a power versus a non-power port. A power port is designed to withstand high-pressure medication administration, such as those administered in CT scans. But a non-power port cannot withstand these high-pressure medications and could cause harm to the patient. It's important to select the right needle type to differentiate between the two. The power port is the one on the right, and the non-power port needle is the one on the left. The patient often knows what type of port they have, but if not, it's possible to find this in the operative procedure report on Epic in the notes section, or ID cards the patient might have. If the type of port cannot be found, access it as a non-power port for the patient's safety. You'll first apply a mask to your patient for them to wear throughout the procedure and assess the port site for any signs of infection. Locate the center of the port by palpating the site with 2 fingers on either side. The center should feel bouncy, and this is the site you will place your port needle. First, perform hand hygiene. Set up your sterile field, placing all supplies on top. First, attach your flush to the Luer lock cap so it is ready to connect to your port needle. Place the blue cap on the inside of the sterile field, but keep the flush on the outside as it's not considered sterile. You'll place your CHG swabs on the top as well. Your power lock needle. And I typically place my 4x4 gauze pads off to the side along with my Tegaderm dressing. Next, you'll don your sterile gloves. Next, take your CHG swabs and cleanse the site for about 30 seconds, starting in the center of the site and working your way out. After you're done cleansing the site, you'll let that air dry before accessing. Attach your power lock needle to your Luer lock cap that's attached to the flush. Avoid touching the flush to maintain sterility. Pre-flush the needle with saline prior to accessing to avoid pushing any air into your patient. Take your needle, angling at 90 degrees, and push it into the center of the port while placing your fingers on either sides of the port device. Then use your 4x4 gauze to verify blood return and flush your port. If the blood return is not visible, it might indicate misplacement and the needle may need to be reinserted. You'll do your sterile dressing next over the site. The CHG square will be placed directly around the insertion site to help prevent infection. Next, you'll place your Tegaderm over top of the CHG square. Next, you'll place what we call the pants of the dressing and place it underneath the Tegaderm. Make sure you don't put it upside down. Then you'll use this strip to write the date and the time that you accessed the port, along with your initials. Document in Epic appropriately.